Some refugees arrive to the United States with illnesses that require specific types of doctors called specialists. Specialists are doctors that focus on the care of certain parts of the body. For example, if you have a problem with your heart, you will be sent to see a heart doctor, which is a cardiologist. Another example is a women's health doctor who works with pregnancy, birth, and other women's health needs. This is called an obstetrician and gynecologist, also called an OBGYN. Before you can see a specialist, most health insurances will ask that your primary doctor make a referral for you. Your primary doctor will check your health and decide if you need to see a specialist. Your primary doctor is the doctor you will see at least once a year for checkups and more often if needed. They will check your health and make a plan with you to better your health. This plan may include you getting medical tests done, getting medication, or a referral to a specialist. It is important that you talk with your doctor and bring any paperwork with you about health conditions you have, especially if you think you need to see a specialist. This paperwork can include your overseas medical report or any other tests and results from overseas. You should work with your doctor to find a specialist that takes your insurance. This is important as it reduces the cost of the appointment with the specialist. If a specialist does not take your insurance, they might request you to pay from your own money before your appointment. It is important to follow all directions on your referral form. If you have questions, it is important to ask your doctor to be sure that you understand all of the directions and your referral. If you get a referral, it is important to make sure you understand it well. Ask questions during your appointment, and if you are comfortable, share this paperwork and information with your caseworker. Some specialists need you to have certain medical exams done before meeting with them, such as blood work or an X-ray. It is common that appointments for these doctors to be made far in advance, sometimes weeks or months ahead. It is important to keep your appointment because it can be hard to reschedule. This will delay you from getting the care you need. If you have a job, remember to tell your boss in advance when you have a doctor appointment. This will help you and the boss arrange for the day if you cannot make it to work or might need some hours off in case you cannot come in for work that day. Some types of health insurance may require you to pay a fee called a copay when you see a specialist. These fees are normally listed on your insurance card, but you can also ask your caseworker or health insurance company about any possible copays. Recap. A specialist is a doctor that focuses on certain parts of the body or certain illnesses. Your primary doctor is who you will see at least once a year for a checkup. A checkup is when you see the doctor whether you are feeling well or sick to check on your health. After seeing your primary doctor, they may recommend seeing another doctor or specialist to get more information on your health needs. Before you can see a specialist, your primary doctor will have to make a referral first. They may have to do some medical exams before you can see the specialist. Work with your doctor to find a specialist that takes your insurance. If they do not take your health insurance, you will have to use your money to pay for the visit.